I guess I don't have to tell you what I will be talking about today, right? What's one of the main awareness for the month of February? It's heart. Yeah, love, but it's heart. So today I will talk to you about a different kind of love, but it still comes, it's connected with the heart. So, right, so it's the American Heart Month, and I don't think we can talk enough about it. And it looks like either we are not doing a good job in keep bringing awareness of something is just not clicking, because the numbers are just not looking good. They're not getting better at all. As the years go by, we still seem to have higher and higher numbers. So just like not the best statistics that I can give you right now, it's, as you can see, about 2,200 Americans dies of cardiovascular disease each day. Imagine that. So one death every 40 seconds. So just being here in the church for a couple of hours, there are quite a few people out there that will end their journey because of heart conditions. Now, as we see here, cardiovascular disease claim more lives each year than all forms of cancer and chronic low respiratory disease combined. So it's still the #1 killer. This is a very recent statistic. This is kind of what happened last year. Almost 1 million people died of heart conditions. So yeah, it really saddens me, because a lot of these things we could do better. And it's kind of like maybe you may want to ponder seriously about it, what you can do in your own life that you'll not be part of this statistic, because it's very sad to see this kind of statistic that can be preventable. Just to give you a little idea of how things work, how our pipes work. And as you see, it's a healthy artery, so the flow can go really nicely. If it's partially blocked, there is some restriction. And when it's blocked, it's very hard for the blood to flow through freely, and that's where all these problems with, getting tired, pain, and all these things come. So now you know why. It's kind of, I always tell my patients, it's a plumbing issue. So it's like we gotta unplug all these, pipes so that the blood flow can go as it's supposed to. Now, I'm sure probably some of you are aware of some of the common heart attacks warning signs, and I find that people who need to go to hospital when they have this, they don't go, and those who shouldn't go, they go. So we'll go through these signs again, and even if you think that you're totally fine, it's nothing, it's always better to be safe than sorry. You do not play with the heart, especially if you are after a certain age, you may have some comorbidities, or if you have family history, do not play with it. Just give that call, and Chris will be there right away to come and bring you to us. He brings me quite a few patients down the road. So one of the main signs is pain or some discomfort in the chest. Just recently, we had a lady, she was in her, early 60s? She came because she said, I have indigestion. Mercy, we put her on the cardiac monitor. She's been running some weird rhythms, and we had to get a code card. We thought they would have to, resuscitate her just from indigestion. She had full-blown, heart attack. And that's why I'm saying it's not, even if you feel like it's just something light, do not play. Please call. Please come. Don't drive yourself. That's one of the things. Do not drive yourself. So pain, discomfort in the chest, lightheadedness, nausea, vomiting, also are signs. Also, sometimes goes to the jaw, you feel like neck pain, back pain. It's weird. Especially, women tend to get a bit weird symptoms. She never had chest pain per se, she just felt indigestion, or sometimes just feel your shoulder is not right. And when you check it out, it actually had a heart attack. So also discomfort or pain in arm and shoulder, and shortness of breath. So whenever you see these signs, do not feel bad to call 911. Now, as I said, call 911. It's super important. Do not let a family member to drive you, because 911, they have resources to help you get treatment much faster than if you just drive, you are actually with a family member or something like that. So just call the EMS staff. It's super good, and we have really good, actually, providers in the area. Very nice. They're always ready to help, so call them. Now, we've been talking about all these bad things, but let's also add a little bit more of cheerfulness, stuff that we can do to bring joy and to improve our quality of life. So let's make better choices of what we put in the plate, because what we put in the plate influences how clogged those arteries or unclogged will be. So let's make better choices. Add color. Eat colorful foods. Again, add some movement. And that will definitely also not just help you for the heart problem, but will help you for the whole body. So talking a little bit about how to eat smart. So don't have to just put stuff there that's boring. Food can be very wonderful. Just find dishes that you will like and eat them with pleasure. And of course, try to strive for nutrients-dense fuel, because that will help, that your body will thank you for that. Now, color. I see that a lot of people tend to be very kind of just the same thing every day, the same thing. It's like we kind of decided, Mark and I, to try to do things different, like not just the boring thing. Like let's add different colors. So, on a side note, we are recommended to have at least 30 varieties of different foods. Now, that includes also herbs and this kind of things per week, in order for our microbiome to develop well and to function well. So it's very important to just add some more color, find ways that you like to combine foods that are healthy. So fruit and vegetables, also try not to limit your serving of fruit and vegetables. And sometimes, when I ask people, so how much fruit and vegetable did you have, today? Or some of them, they don't even eat fruit and vegetables, which it's hard for me to grasp because I cannot live without. But yeah, let's encourage one another to make better choices. And frozen fruit and vegetables are also a very, very good option. And they're very handy when you're busy. Just grab it and do something with it quick. Now, cannot talk enough about this movement. So a good starting goal is at least 150 minutes a week. Is that much? 150? Some people do 150 a day. So just again, if you are not used to exercising, start slow. Even 10, 15 minutes a day will make a dent. So try slow and get somebody to be with you. It's always nicer to do things together. So we're very, very blessed that we just had a gym open a few months ago, 8 minutes from our house, because we didn't have one. And it was so hard to, to kind of do the exercise that we wanted. So at the gym, you see people that are starting to come, and it started creating a little connection there. And it's always nice to feel like, hey, I'm not alone in this journey. And it's just beautiful to meet new people, to just make more connections. So find a form of exercise that you will like. Now, I have to tell you something. Don't look always for things that you like to do. Do things that you don't like. I don't like to go to the gym at 5 in the morning. Honestly, I really don't. I would rather stay and sleep. But it's like I want to go against my feelings, because I know if I don't get that exercise before breakfast, the day will be different. So find ways to do something, even if it gets you a little bit out of your comfort zone. It does help. Go against your feelings. It really helps. Now, again, it's very good to eat right, it's good to be active, but also do not forget about getting enough sleep. And when it says practicing mindfulness, I'm not talking about the New Age style of mindfulness. I'm talking about be present where you are. There is nothing more disturbing. You pass by and you see two people at the restaurant eating, and guess what? They're both like sitting at the table and they're on their devices. I feel like go and take their device, like, can you please talk to each other? It's just be present where you are. Enjoy the people that are around you. Don't find ways to keep yourself always busy. Just enjoy, like look through the window. Take time, admire whatever can be admired. Be present, because that helps also with stress. And stress is another big killer that we need to work with. Learn to say no to things. Don't put too much on your plate if you feel like you cannot manage all that. Learn to say no. There is nothing wrong to say no if you know that you are not able to fulfill that responsibility. Also, try to keep the connection, social connection. It's very, very important, the social connection. Don't become a hermit. So, and that is a very good counsel. If ever there was a time when the diet should be of the most simple kind, it is now. And I think you all can agree with that. And Proverbs also tells us in Proverbs 23:26, my son, give me your heart and let your eyes observe my ways. So let's try to do things that will glorify God, that will keep ourselves healthy so that we can glorify God through our bodies. May the Lord bless you all.